All right, class. Let's go ahead and deal with chapter 27. This is the male reproductive system. It's been said our genes live in our offsprings. Because with that, male and female share their genes and will dictate what the next generation will be. So, very interesting. From this, we are hoping to understand the fundamental biological distinction between male and female. And as we go through this chapter, I need you to be particularly aware of what are the similarities and the differences. Similarities and differences. Also be aware of the effect of hormones. Okay. Also be aware of the pathways, how it happens. As we go through, you'll be able to determine uh, how it becomes a male and how it becomes a female offspring. The Y chromosome determines the response of the fetal gonad to prenatal hormones. And it's also true when you identify the male and female genitalia. As we go through this, you will understand that sexual reproduction is biparental. It means there's got to be a male and a female. Gametes or sex cells are produced by each parent and they share this, and then you fertilize the egg. The egg, which is fertilized, is called a zygote, which is a combination of both parents' genes. The male and female gametes combine their genes to form this fertilized egg. One gamete is the sperm, which has the Y chromosome, okay? The other gamete is the egg, which has the X chromosome, right, huh? And when they combine, you will have the fertilized egg. In mammals, which a human being is a mammal, the female parent is one that provides a sheltered internal environment and prenatal nutrition of the embryo. Keep note that in seahorses, another species different from us, the eggs are given to the male, and the male almost provides a sheltered environment till the eggs are hatched. Huh? Interesting, huh? Now, the male reproductive system serves to produce a sperm and introduce that into the female body. And the female would then receive it. And with that said, the female who produces the eggs will be responsible for uniting the two. And it will also be responsible, the female reproductive system, for nurturing the fertilized egg in the uterus. So the reproductive system consists of primary and secondary organs. Always remember, primary, secondary. It's easy. Primary is the egg and the ovary rather, the ovary and the sperm cell, right? The primary sex organs for what we have is, well, the ovaries producing the egg and the testis producing the sperm cell. Let's do it that way. Ovary producing the egg, and the testis producing the sperm cell. So the primary gonad here would be the ovaries and the testis. All others that you always hear, all other organs of the reproductive system, like for example, the uterus, the fallopian tubes, the vaginal canal, the cervix, or even in the male, the um, vas deferens, prostate gland, all those are secondary. All those are just secondary. The primary is always going to be the testis and the ovaries. Okay. Now, as far as the genitalia is concerned, the external genitalia, which is visible, would be more in the male, huh? More in the male, because the male is more, the genital is more outside, while the female is more inside genitalia. You do not see a female with a uterus hanging down below. Okay, that probably will shake you up. You don't see the female human being with fallopian tubes hanging down. No, it's all neat and inside the human body, the female human body. So we say the male is more external, and the female is more of an internal setup. Secondary sex characteristics will then differentiate the male from the female. Huh? Both of them will have different pubic and axillary hair growth. The pitch of the voice will also be different. The female and the male will also have a different degrees of fat, uh, and in muscular development. When a girl shows all the usual changes of puberty but fails to menstruate, there must be something wrong with the system. Could be the presence of testis in the abdomen. It could be karyotype of XY chromosome. The testis produces normal male levels of testosterone, but the receptors are not there. So you will have external genitalia develop female anatomy as if no testosterone were present. There will be no uterus or menstruation because it's really more of a male, but there was just no receptors for the male. See, we call it androgen insensitivity syndrome. Androgen insensitivity syndrome. Okay. Chromosome sex determination. Our cells contain 23 pairs. 22 pairs are autosomes, while the last pair is sex chromosome. Sex chromosome pair could be either XY or XX, right? Huh? Now, all eggs from the ovaries will always be X, while the sperm can either have an X or a Y. There you go, huh? And so, if the sperm is delivered in the female reproductive system, some of them will be X carrying sperm, and some of them will be Y carrying sperm. If the X carrying sperm is a successful sperm that connects with the female egg, then you will have an XX, a female offspring. If it's a Y carrying sperm that determines or gets into the female egg, then you have an XY, which is then a male offspring. A fetus is interestingly sexually undifferentiated when in the beginning. Huh? Gonads don't get to develop till about 5 or 6 weeks. Then it will have two sets of ducts, one for male and one for female, right? Huh? Beginning, we have male and female. In the male, it's mesonifric. In the female, it's paramesonifric. Okay? So if you have both of them and you turn into the male species, then the mesonifric dominates and grows, while the paramesonifric in you degenerates. If you're a female, the paramesonifric develops, while the mesonifric of the male potential degenerates. Okay? Now, the breakaway happens because the male has the Y chromosome. And in that Y chromosome, you'll have genes. There's a specific SRY gene, sex determining region of the X of the Y chromosome. Of course, because it's a Y chromosome, it's only found in males. For this, the SRY codes for a protein. The protein is the testis determining factor. This will initiate the development of the testis in the male. The testis begins to secrete testosterone, a hormone, male hormone, at about 8 to 9 weeks. So around 8 to 9 weeks, changes will happen. This will stimulate the mesonifric and make it develop into that. When this is happening, you will also secrete, the testis will also secrete an MIF, male Mullerian inhibiting factor. So you see there's two factors, TDF and MIF. The TDF is for developing the mesonifric, while the MIF will be developing or degenerating the paramesonifric. Huh? Again, TDF is for developing the testis, while MIF, Mullerian means paramesonifric. So MIF is inhibiting the paramesonifric. Now, in pregnancy, the estrogen will be high. If there is no testosterone present, estrogen can be a very strong influence. It can happens, all fetuses will be female, would be feminized from mother's hormone, right? Female development of a fetus occurs when there's an absence of androgen hormones, right? Not because of too much estrogen, but there is, in the female, there is an absence of androgen because there's no Y chromosome. Now, here we have the reproductive tracts, okay? You would have the different items that would develop in the female and the male. Let me check this. You will have genital tubercle, urogenital folds, and labioscotal folds. The genital tubercle becomes the head and glans of the penis, or in the female, it becomes glans clitoris. The urogenital fold becomes part of the male urethra, and then it becomes a labia minora in the female. But the labioscotal fold becomes scrotum or labia majora. So keep in mind, we both have them. They both have all these. You will have a urogenital fold. You will also have the um, urogenital fold, the genital tubercle, and the labioscotal fold. So for the genital tubercle, if the male develops, you will develop the glans penis. If the female develops, you will have glans clitoris. In the urogenital fold, if the male develops, it will be part of the penile shaft, and in the female, it will become labia minora. The labioscotal fold will become the scrotum in the male and will become labia majora in the female. And when we say will become, that means the male, for example, in the male, this would be dominated by testosterone, and all male developments will happen. The female that you see, the possibility of the female tract degenerates, right? With the testis, with the testosterone and the MIF, this will create a degeneration of the female. Now, if the fetus does not have the Y chromosome, so there's no production of the testis or development of the testis, there's no production of TDF, there's no production of testosterone, there's no production of MIF. So the male completely degenerates. You'll be left with the female reproductive tract, and then the female reproductive organ will develop. By week 12, male and female genitalia will be distinctly formed and will be identifiable. Male and female develop from the same embryonic structure with the said homologue. So when you say the penis is homologous to the clitoris, the scrotum is homologous to the homologous. Okay, and for this matter, you will have this development. Okay, you will see that. Right? So genital tubercle, urogenital fold, and the labioscrotal. As you see from this picture, you will have the in the male, like we said, the male proponents or developments, right? The glans penis, urogenital fold, uh, and that all came from the development of the male and the gonads for the male and female descend. Both of them descend. The male descend further. In the male, there will be the inguinal canal created from the pathway of low resistance in the groin. Because of this, you will have in the male the chances of hernias. So the testis begins as early as 6 weeks. By the 7th month, the testis passes through the inguinal canal into the scrotum, and with it brings with it testicular arteries and veins, lymphatic vessels, nerve, spermatic duct, and some parts of the internal abdominal oblique, just to show you that it did really come from the abdomen. When the testis fails to descend, we call it undescended testis, it's called cryptorchidism. Breaking it down, crypt or kidism. Ism means condition of. Crypt is hidden, like Tales of the Crypt, right? And orchid is the testis. That's the medical term for testis. So undescended testis is condition of hidden testis. Happens about 3% of male births. Usually, testis usually descend in the first year of infancy. If not, we need to employ testosterone injections. The worst case is we have to do a simple surgery that brings the testis into the scrotum. If this testis does not get corrected, it can lead to testicular cancer and sterility. So it's important that we follow up. When nursing, when you uh, examine a newborn, part of your physical exam is to examine if you have two testicles in the scrotal area. If it's only one, that should be documented. And in fact, pediatricians are very particular about that. Now, the ovaries descend also, but to a lesser extent, only to the inferior brim of the lesser pelvis. With it also has ligament to support the ovary and the uterus. Here's a visual of how the male testis goes down. You have it right out of the abdominal area, and then you form this low resistance. In fact, because of this, it will be enhanced to go down into the scrotal area. Once in the scrotal area, this inguinal canal should close. And there are cases, though, that this inguinal canal actually don't close, and abdominal contents or parts can a bigger abdomen, the chances for hernia are higher because it will have no other way but to be pushed through there, especially if there's a lot of pressure, Valsalva maneuver happening. And if it does, then you will create the chance for hernia. Let's go to the male reproductive system. Our goal is to identify the scrotum, the testis, penile shaft, and identify the pathway of the sperm. There's also some male accessory reproductive organs. So here's the male reproductive illustration. As for the assignment, you need to illustrate this, right? And there's another picture in your book that will train you to identify the male reproductive emphasis. And here's the penile shaft, okay? The penile shaft will have you the corpus cavernosum, and there's two of this. When we get to the actual shaft discussion, there's two of this, and then you have the corpus spongiosum. Notice that corpus spongiosum is where the urethra is located. The urethra is the inside tube or passageway of both the sperm cell and the urinary contents. Right? In the male, the sperm cell and the urinary content passes through a common passageway, which is the urethra. And again, the urethra is the corpus spongiosum. It's a single body corpus spongiosum. Now, also about this penile shaft, there will be the glans penis, there will be the prepuce. Would be the more sensitive part of the penile shaft. But keep in mind, this is very important. As you see this in a downward configuration like this, do not be mistaken to identify this side as your anterior or ventral side. This actually, in fact, is the dorsal side. And this inside here is actually your ventral side. And how does that happen? The penile shaft anatomically is assumed to be straight. Imagine where my pointer is. It should be straight, pointing upwards. So therefore, if it's anatomically assumed to be pointing upwards, then this becomes a dorsal side, and this becomes the ventral side. Okay, Very important if in case you're describing a lesion, is it happening in a dorsal or ventral side? So then you will not make the mistake. Or if this urinary passageway, the urethra, sometimes there's abnormalities that it will open in the ventral side or it will open up there in the dorsal side. So you have to describe it properly, right? If it opens here, then you should say it opens on the ventral side, right? So just to let you know, a lot of people get confused with that. To continue, this is your testis. This is the scrotum itself, okay? Scrotum or scrotal area. The testis will be adjacent to the epididymis. The epididymis is where your sperm cells are stored and have further maturation. From the epididymis, you will have the vas deferens happening on both sides. It will come to the ampulla, and then it will be pushed out through the ejaculatory duct. In the ejaculatory duct, you will have secretions coming from the seminal vesicle and also from the prostate gland. Then it will go down to join the secretion of the bull. It will be pushed out to become the seminal fluid, right? Which will contain the sperm cells themselves. Huh? So the passageway of the sperm cell is from the testis, actually a retitestis, and then into the epididymis, into the vas deferens, ejaculatory ampulla, ejaculatory duct, urethra, or the urethral orifice. Now, clinically, the doctor examines the testis during annual physical exam. See if there's any pain, see if there's any um, Romeo, E as in echo, DRE, digital rectal exam. Put that in your abbreviation list, okay? Digital rectal exam includes the doctor inserting a palpating finger to the rectum, because through the rectum he has access to palpate the prostate gland. If the prostate gland is enlarged, it could mean it's a hypertrophy or hyperplasia, or it could be the prostate developing to become a tumor. In a physical exam, we always examine the PSA, prostate specific antigen. Because of this, we're able to identify if there is any chances for prostate cancer. Okay? Nursing, do not forget, when you prepare the doctor's equipments for the DRE, you always put the lubrication fluid first and foremost. All right, first and foremost. Otherwise, it will be a day that the patient will always be afraid to come because of a bad experience. Okay, do not forget. There you go. All right. Now here's a human remains picture of it. This is the penis, and this is the crus of the penis, the bulb of it. This is from the human remains, and of course you see the corpus cavernosa. You'll see that again in another picture. You have the external urethral orifice and the glans penis right there. Huh? Glans corpus spongiosum is a singular part in this area, and this is the scrotum itself. Okay. Now, this is the rectal area, which can be adjacent to the area of the prostate. Now, the, make it, there you go. So imagine the penile shaft on a cross section. You will see two corpora cavernosa, huh? Two corpora cavernosa. And then you will see one corpus spongiosum. There you go. And again, the corpus spongiosum has the urethra in it. What happens during erection is this corpus cavernosum, right, gets filled with blood. This gets congested with blood. When it's congested with blood, this spongiosum also, it makes the penile shaft erect. So we need blood supply to make this erect. These are not muscles. This is cavernosus, which means it is filled with blood. Now, if the male has a vascular problem, the testicular artery having a problem or some constriction, that may be a reason for no erection or erectile dysfunction. ED, another abbreviation on your list. ED, erectile dysfunction, which is definitely a lack of perfusion here. Okay, huh? So that's the reason, one of the reasons, main reasons why you may have ED. Go further, I also want to mention that another clinical application here is that if the male has decided to not father any other offsprings, he may elect to have this uh, vas deferens be ligated, be cut, huh? And we call it vasectomy. Ectomy means to cut. So you will have a vasectomy happening. And the most convenient part to do that would be in this area here, where you can approach the uh, vas deferens. You don't want to approach it in this area where you have to go through all these organs. This is really conducive right here, and a little bit on the posterolateral. One day um, visit will take care of this. Okay. In the area of the perineum, you will have this perineal raphe. Okay. You call this the urogenital triangle, and you call this the anal triangle. Right? In the human remains, that would be this area here. Okay. The scrotum is a pouch of skin, muscle, and fibrous connective tissue where the testis is found. Huh? Remember that the left testicle is usually lower than the right. The left is lower than the right, so they will not compress each other. If they are the same level, we will have a problem. Okay, we will have a problem. You will always see male patients in a bad mood, okay, and always in pain. So thank the good Lord that one is lower than the other. There you go. Little humor there. Okay. Now, but it's a fact now. There can be the chance for inflammation. All right, especially when one testicle or the other testicle ends up rotating. Rotating can kink or um, affect the vessels that are connected to the testis. So that's another problem. In fact, orchitis, orchid inflammation, orchido or orchio can induce that pain. Okay, orchitis. Now, going further, you would have an internal median septum and a perineal raphe, which we identified in that last picture. Now, the spermatic cord, like we said, has blood, lymphatic vessels in it, and testicular nerve. This continues through the inguinal canal to the pelvic cavity. Therefore, you will have an internal and external inguinal ring. Huh? The external is the inferior entrance to the inguinal canal, while the internal is the superior exit to the pelvic cavity. And if you see that here, we need to remember that this is done because the testis, or the sperm cells rather, with the testis holding the sperm cells, do not want a temperature that varies too much. It doesn't want warm temperature, doesn't want cold temperature, but definitely not the core temperature that we have. That's why it's further from the body. This is spermatic cord. This is the testis. This is ductus deferens, and this is the epididymis. There you go, huh? Happening in the human cadaver. You also see the spermatic fascia and the vas deferens here. You also see the pampiniform plexus, which will play a big role in the discussions later on, and testicular artery. You also see an example of the cremaster fascia muscle. So the scrotum has mechanisms to take care of that temperature sensitivity. When it is cold and the testis is getting cold, it will use the cremaster and the dartos fascia. These are coverings in the testis of the scrotal area where strips of internal abdominal oblique, which is the cremaster, contracts to draw the testis upward towards the body. At the same time, the dartos fascia, which is part of the subcutaneous layer of smooth muscle, it connects to that, also contracts, therefore holding the testis closer to the body. Now, visually, the dartos is more outside. The dartos muscle is more outside. The cremaster muscle is more inside, right? And therefore will both contract to bring the testis closer to the warmth of the core. That's during cold weather. In warmer weather, this may relax letting the testis go further from the core. You also see here the spermatic cord with the vessels, the pampiniform plexus of veins, right? And look at this, the part here, you'll see the fascia of the spermatic cord on this side, and then you'll also see the vessels there on the penile shaft. Those are dorsal vessels, because we said this is the dorsal part. The bottom part is the ventral part of the penile shaft. The pampiniform plexus, like we identified here, okay, pampiniform plexus, also tries to maintain a good temperature. If it's too warm, it makes the temperature, makes the blood be cooling off a little bit, right? Huh? If it's too cold, it will also shift it so that it will make the blood a little bit warmer. So you see, it can remove heat from the descending arterial blood so that it will be cooler for the testis, right? Huh? Without the pampiniform plexus, warm arterial blood would heat the testis and inhibit sperm production. So it's very sensitive to temperature, as we said, huh? There you go. So the venous blood carries away the heat as it ascends, right? And therefore, make sure the temperature coming into the testis is the right temperature. The testis is a combined endo and exocrine gland. Each testis is oval and slightly flattened. It will have a tunica albuginea capsule around it and will have septa dividing it as well. The human remains, this is the testis itself. This is the epididymis. Okay? The testis has seminiferous tubules, tubes, small tubes, so we call it tubules. But it's seminiferous, which means it can be perforating all around the area. This is where the sperms are produced. Each tubule is lined with thick germinal epithelium. Germinal means that's where the beginning cells are. This germinal epithelium will have sperm and nurse cells. Nurse cells protect the germ cells and promote their development. Germ cells depend on them for nutrient, waste removal, growth factor, and other needs. But the sperm cells will develop from that germinal epithelium. Now, this is in the seminiferous tubules. Sperm cells come from the seminiferous tubules. The interstitial cells produces the endocrine role of the testis. This produces testosterone, which will be distributed to the blood flow. So again, this is the endocrine role of the testis, producing testosterone. The exocrine role is the testis through the seminiferous tubules producing sperm cell, which will be delivered through the ductus deferens using tubes. So therefore, when you use tubes or ducts, you are performing an exocrine, all right, an exocrine activity. All right, good. Quick picture of the seminiferous tubules. And you also have the lumen, the inside. So what happens is the young sperm cells are started here on the peripheral, and as they age, they grow towards the center, until finally they are mature and develop. They will be around the lumen. They will flow into the lumen. This is through the lumen of each two of the tubules, and these tubules will flow all the way to the rete testis, collected, and then into the um, epididymis. There's also a fibromuscular layer and the sustentacular cells. You also see the primary spermatocytes and the mature ones here. Look, it's in the peripheral, and it's in the inside lumen already, ready to be uh, passed on towards the rete testis. Outside, the scrotum looks like this. If taken out, you will reveal the testis with the albuginea covering it, and you also see the head of the epididymis here. The testis has a BTB, another abbreviation is blood testis barrier. Tight junctions, which separates tight junctions between nerve cells. This will separate the sperm from the immune system, so there would be no antibody formation against the sperm. Um, that's the safest and the natural way. We don't want the immune system to develop antibody to the sperm. Otherwise, you will have destroyed all the possibility to create sperms. Here is the seminiferous tubules on a cross-sectional view. You'll see the young spermatids, right, growing from the sides, and then they will become mature sperms there. So this is a tubule, cut on a cross-section. There's another tubule here, and another tubule here. That's the exocrine role of the testis. However, you have this interstitial. It's outside of the tubule, so we call it interstitial. Interstitial cells that produce testosterone. There you go. Interstitial endocrine cells. This is where the male testosterone is produced. There's also some in the adrenal glands, androgen, but this is foremost one of the uh, prominent areas where testosterone is being produced. Retitestis is a network after the tubules, and a testicular artery supplies each testis. Low blood pressure results in poor oxygen supply. Sperm develops large mitochondria to cope with this poor oxygen supply, and they help it develop and survive in the hypoxic environment of the female reproductive tract. So actually, it's good because they will have a stronger mechanism of mitochondria, right? Which also makes them more like Spartans, able to survive harsh conditions. Blood leaves the testis through the pampiniform plexus of veins and forms the testicular veins. Right drains into the IVC, inferior cava, while the left drains into the left renal. Nerve supply comes from your segments of T10 and T11, carrying pain and sympathetic fibers. Here's a picture of the ductules, seminiferous tubules rather, right? Many of them. Look at that, how so many of them, right? They all produce sperm cells. Eventually, through the lumen, they flow, and they will get into the retitestis. Retitestis. This will eventually spread it through the epididymis. So look at that, how condensed that is. Look, so many tubes in just one really small spot. How much more with all the rest of the epididymis? That's why it can really have a good enough volume. At the end of this epididymis, it will become part of the vas deferens here, ever so filling the space. Imagine that. All of this coming in and then becoming the ductus deferens on its way to the ampulla and into the ejaculatory duct and into the urethra. Okay? There's about 12 ciliated ducts opening, collecting sperm, and then, like we said, it ends up in the ducts of the epididymis, and then eventually the sperm mature, travel through the duct. If they're not exposed or taken or ejaculated, they disintegrate, and the epididymis reabsorbs them. Okay, so that's the same thing that will happen if you had vasectomy. When the sperm is not ejaculated, they will disintegrate, and the epididymis reabsorbs them. Okay, we mentioned the ductus deferens, and then we mentioned the ejaculatory duct as well as having shown that. The human remains, this is the ductus deferens, all the way to the ejaculatory duct inside. Okay, this is the ejaculatory duct connecting through the prostate. You can always also see this, the spermatic duct. This is another view of the male organ. This is the second illustration that you're supposed to draw, or like a posterior view. You can see the uh, vas deferens getting into the ampulla, and then you can see the seminal vesicles, and then through the prostate, and then through the corpus spongiosum. I let you illustrate because by spending time illustrating this, you actually it will help your retention. This is a tactile training. So as you draw this, don't just draw it. As you're drawing it, illustrating it, say to yourself, this is the vas deferens. So I went from the uh, tubules to the retitestis to the epididymis to the vas deferens as you are illustrating it, into the ampulla, into the um, ejaculatory duct, and into the urethra. See, this will help you retain it. So very important that you actually illustrate it. Now, after illustrating it, you're supposed to try to illustrate it again, and hopefully by memory, maybe a third try, right? If you do this, it helps you retain it better. That's the purpose of the tactile training. Okay, huh? So I could take the third. I don't know. I don't care if it's the worst illustration as long as you tried it yourself. You may look a little bit, maybe once to four times, maybe. But otherwise, you could almost illustrate it by yourself. Help yourself, huh? Train yourself. It will have to come also from you. Okay? And what do we need this for? Of course, we need to be aware of this for your patient care. You will have male accessory glands, seminal vesicle, prostate, and bulbourethral gland. Seminal vesicle gives about 60%. The prostate gives about 30% of the seminal fluid, and 10% would be the sperm and secretions of the bulbourethral gland. Okay? Here's a bulbourethral gland, which helps to produce a clear, slippery fluid that helps to enhance and promote um, the delivery of the sperm. Huh? Now you also see some prostate gland pictures here. If we have the tubuloalveolar glands and the prostatic concretions there. Conditions that are related to the prostate gland are BPH, benign prostatic hyperplasia, and which is a non-cancerous enlargement of prostate, but it can compress the urethra and obstruct flow. If that happens, you will promote bladder and kidney infections. You will start to see these changes when there's more holding of the urine. There will be the extreme situation is when the male patient really wants to urinate but cannot urinate because the uh, prostate gland is in hyperplasia, thick. So what would happen is he will have to be given catheter, which will then help him relieve himself. The catheters sometimes are placed on the side of the thigh, right? Another procedure here is done by the urologist. By the way, the two specialists involved in the male reproductive could be the urologist, especially in this procedure where the urologist will perform a TURP. TURP means transurethral resection of the prostate. So he will use a sound, a long cylindrical object, to go ahead inside and scrape down the prostate gland. Really scrape down so you can clear the the tight passageway in the prostate. Could be a little bit bloody, but it clearly helps when it heals, provide a passageway. We're also starting to use laser, huh, in order to take it out. Prostate cancer, another clinical event that can happen here, is the second most common cancer in men after lung cancer. From here, tumors can tend to be close or to be at the periphery of the gland, and they may not be creating a problem until they cause pain, but they can metastasize or spread through nearby lymph nodes to the lungs and to other organs. That's why when you biopsy the tumor, you'll find out they're not cells from that organ. They came probably from another site, let's say from the prostate. So you know it's a metastasis. See? So we perform a DRE, digital rectal exam, and we also take blood levels of PSA and acid phosphatase to confirm if there is a prostate cancer problem. The penile shaft serves to deposit semen in the vaginal area, and because of this, you're able to deliver and secure that the seminal fluid is near the cervix. From the cervix, it will tend to get the seminal fluid inside the uterus. From there, you will end up with the sperm cells going through the uterus in order to make it to the fallopian tube. From the fallopian tube, they will meet at the distal third of the fallopian tube, meet with the egg cell. All right, huh? Then you will have cylindrical bodies, like we said. You will have corpora cavernosa, two of them, and the single corpus spongiosum. So if you see it this way, you will see again the cavernosa and the spongiosum. This looks like a picture of a animation character. Look, and I say that because I need you to animate. I need you to like relate whatever you see in anatomy to something that's similar or quite different or even funny. That's how you retain the picture of it. So it look like eyes here, really, doesn't it? And then you got the lips here and the mouth. The mouth becomes the urethra. See? Again, this side is the dorsal side, the back side. This side is the front side or the ventral. See how they identify the vessels here? They are dorsal vein, dorsal artery, dorsal nerve. They are the back, dorsal, huh? All right. Um, we'll take a break from here and then continue with puberty, hormonal control, and climacteric.